AI will not replace the dentist. People who will survive in dentistry over the years will be people who use digital technology and AI for the management of patients.
Professor Chew Chong Lin is a respected academic and prosthodontist specialist, known for his leadership in education and professional mentorship. He has served as president of the Singapore Dental Council and a member of the Dental Specialists Accreditation Board, contributing to high standards in dental practice and education.
How do you keep up and stay so interested in dentistry all these years?
I find that the dental profession is a very interesting profession and very rewarding profession.
You mentioned that when you went to the States, something changed. What made you change?
In America, they train you to think. They don't just spoon feed you. She glared at me and told me that when you come to the United States, you don't ask questions like this. You gotta do your own thinking. You're going to write a project up and then you give it to me, then I'll give my comments. So I think that these people educate you really.
What made you decide that quality precedes volume or quantity?
I used to tell my students, I said, you people don't have a license to practice and you're using my license. If you do bad work, I may lose my license.
Do you think doctors will be replaced given the technology?
Obviously based on mine.
Dearest Prof Chew, I am so honored today to be on our dental podcast to have you, somebody so distinguished and such a legacy in our industry, to be able to come in and share your experience and your life advices with us as well. For those that do not know Prof Chew, he is a legend in this region of Southeast Asia, and probably to the overseas listeners, you have had a distinguished career in dentistry, primarily at National University of Singapore, Faculty of Dentistry serving as Dean, then Head of Departments, Director of Graduate Studies, also holding key roles like President of the Singapore Dental Council and Chief Dental Officer. You've done a lot, and guess what? To Prof Chew, if you don't mind, we've just celebrated your 80th birthday and I flew down to Singapore because thankfully I was invited to this celebration and it was amazing. And I remembered when I first met you nearly 30 years ago now. You've inspired me to be better, and that's what this podcast is all about. I don't think I can fully ever explain how legendary you are. And I am extremely lucky to be able to invite you here because it's anybody that works and are so passionate all the way up to 80 and still contributing to our industry, we really have to look up to, and I think we have a lot to share today. All right, Prof Chew, can you explain a little bit? How do you keep up and stay so interested in dentistry all these years and continue to learn and keep up with what's going on and still see patients at this age and telling me that, there are some people who just says they want to quit when they're 50 years old or travel around the world and don't do anything by 60. You are still seeing patients, you're still serving the boards, private and government, and advising dentists, younger ones, teaching them. How do you do it? Yeah.
Well, I think that first, Jeanette, I want to thank you for inviting me to do this podcast because it's an honor. And also thank you very much for your kind words. And I'm also very grateful for you to be present during my birthday celebrations. Really is a surprising and pleasant surprise. Coming to your question about what I'm doing now, what keeps me going on, I think that when I look back at all these 80 years, all right, even though I didn't exactly know whether dentistry is a career that I wanted to go in at that age, a young age, I just went in and I found that we go through dental education in a different kind of era. And I went to study in the States. And I think that was a changing part of my career. But what keeps me really going to even still practice dentistry today is actually a very simple thing that I think most of us wouldn't have actually experienced. Because for me, I find that the dental profession is a very interesting profession and very rewarding profession in the sense that you are contributing to the overall health of the patient, although you're actually treating only a small area of the mouth. And you have the what I call the opportunity to not only learn from the dental profession itself, but a lot of learning comes from the patients.
Yes.
And the learning that comes from the patients are never in the books. And that is where I find it very enriching. But when you look at practicing dentistry up to today, I think you have a kind of opportunity where you see different patients every day. And these patients are with you for many, many years to come. And I think that that's where we are slightly different from the medicals, in the sense that for the medicals, the patients will only see them when they are sick. But in our situations, because we have a practice of doing regular recalls to the patient, they therefore come back. And you can see the progress from that of your treatment planning, whether it's successful, and you have a very closer communication with the patient.
Yes.
So I think that all this makes it a very rewarding profession for me, and that I can still carry on with that kind of a activity, even though I'm 80 years of age, and I hope to be able to continue doing the same thing because of that challenging experience that we can look forward to in the next 10 years to come. Yeah.
It's amazing because nobody would speak like you. And I think we have had quite a few guests now, and we always talk about what's hard, what's difficult. And you just came in and said, it is so interesting. This is our industry that makes it a difference. And we build relationship with patients that last for almost entire lives. I've seen many of your patients that became very good friends and very successful. And that's how we build our pool. So we do have a very interesting career. And for the young ones, a lot of people don't realize. They just take it as a profession and a career, but actually we do have a very interesting career.
Yeah.
And we do, the association of bringing it from dentistry to medical is where we are going to now, actually, with wellness. And in the earlier days, I think in the 70s when you first started, I don't think people ever talk about dentistry affecting general health when you were taught. And yet you have come so far to realize that what it does to the patient. So when you first graduated from dental school, what made you mentioned that when you went to the States, something changed. What made you change?
Well, I was trained in a undergraduate program where a lot of things had to be done by yourself, in the sense that the technology that is available today was not available 40 years ago. And when I was asked to go to the States, I was asked to do a subject that probably 99% of students wouldn't like to do, and that is dental materials. But I was surprised that I was able to work in a school where the top dental materials person is going to be my chairman, and that's Dr. Ralph Phillips, who wrote a book on science of dental materials. And I got in because my professor knew him, and that personal interaction or network actually got me a place. But I still was actually not too sure what I was going to go through. But as I studied, I found that it was very interesting. I got very good teachers. And Dr. Phillips was a very great teacher, not only in materials, but also in the way people should look at things. And therefore, it helped me to look at things differently. Another great thing is that in America, they train you to think. They don't just spoon feed you. And my personal experience was one that I can never forget, because materials training in there is actually both science, and also I have do a minor in clinical, and I did it in removable prosthodontics. So a lot of it has to do with research. So I went to my professor and said, have you got any research project that I can do or not? She glared at me and told me that when you come to the United States, you don't ask questions like this. You got to do your own thinking, You're going to write a project up, and then you give it to me, then I'll give my comments. So I think that these people educate you really. Not just teach you, but educate you. So I thought it was a very rich experience. And therefore that changed my career to be one that you search for answers and you think through everything that you do. And that was a major thing I learned from my training in the United States. Yeah.
That's very similar. I mean, especially in Asia, we are used to the spoon-fed system because we tend to, look after everybody, the younger generation, very well, and we spoon-feed them. In actual fact, sometimes we're not helping them. Yeah, and I think that explains why a lot of your students actually graduate from the States as well, from all the universities, because I think there is a difference in postgraduate training.
That's true. That's true.
Around the world. And asking the right questions is extremely important to be able to think. If not, you're spoon-fed, you would not even ask the questions in actual fact. Yeah. So how did you, decide later on to come back? And then the next step was you ended up in the academic route. And most people that come back, they would think about practicing in private practice, making money, doing, as much as they can, seeing patients. That's the first thing they think of. But in your case, I noticed you came back, you served, you did, and then to lead in education and to create a dental school that's world famous. It takes a lot of effort, a lot of thinking, and, a lot of altruistic qualities to be able to do that. What made you decide to do that, or did it come naturally from you?
Actually, it was in a way circumstantial, because I was sent to US on a scholarship by the university, and therefore coming back I got to serve a 5-year bond. And it was during that time that actually I found that my training was very relevant to academic life, because dental materials is not a private practice entity that you train in. And therefore, by serving in a university and by teaching and interacting with the young students and my young colleagues, I thought that was actually a learning experience itself. And teaching was fun, all right, because it keeps you young, in a way, because you're dealing with young people. And it's always a challenge trying to change the way people do their work. And so this challenge is always on. It's even today you find it's a challenge. It's only different challenges. And therefore, academic life has been rewarding. And partly because I had very good bosses who supported me for what I wanted to do. I mean, had it been a different kind of boss who say, okay, no, you can't do this, you can't do that, then I think probably I would have left. But I had the fortunate experience having good bosses, and that encouraged me. And then when you look at the graduates that come out from the university doing well, and coming back to say, I'm after graduating, I understand what you're trying to do, and I want to thank you for it. Then that's another form of reward that makes you want to continue to train people to that level. Yeah. So that was how I continued in academic life for so long.
Yes.
Yeah.
No, I think you're probably one of the rare ones in this region that really lifted the dentistry standard for Southeast Asia. And of course, we were third world countries in those days, and dental care was not a priority, most of the time. And to be able to train good dentists that deliver work that allow patients to want to come back to see us, I think that has been what you've built, and that changed the way how things were practiced here.
Yeah.
I think in your time, I still have patients telling me in those days they just extract when you are 15, 16 and put dentures on. So if the teeth were not in the right position, there's nothing wrong with the teeth, just not in the right position, not beautiful smile. All you do is extract. And they were not even done by dentists in those days. I think they were done by, we still have patients that say that. So I think to a lot of listeners, they don't realize which era you were at, where you actually make a big shift in how dentistry was. You trained many of us, and many of us thank you for that. And I don't even know how you did it, but we have this story to share. I remember being a fourth-year dental student, and I did an exchange program with Singapore Dental University, and they all told me, if you meet Prof Chew, you're going to be very serious. Because they were all, we as students were all afraid of you, because you were very strict in making sure that everybody deliver high quality work. What made you decide that quality precedes volume or quantity? In a lot of dental schools nowadays, it's very hard to create the right educational background or the right team, because most students nowadays, it's either even in normal school, forget about dental school, parents are such that they're overpowering, and kids don't necessarily allow themselves to be able to go through hardship. How do you handle your students now? Have you changed from 50 years ago and 40 years ago and now? Do you see a shift in how you educate your students?
I think that it is true that the students have changed over the years, even from the time when I was a student until now, because the dental needs of the population were very different.
It's true.
We were trained mainly in basic dentistry. And I think that it's very important that when you actually are training them, you got to include in your training the understanding that in dentistry, you're treating a patient even as a student. There is no other profession that does that.
That's true.
And therefore, the responsibility of the student and the responsibility of the teacher is different.
That's true.
And the reason I find that we need to train the students to understand quality, because what you do is actually going to the patient's mouth. It's not like just studying and taking exams. And I used to tell my students, I said, the reason why I have to push you people in that direction is because you people don't have a license to practice. And you're using my license. And therefore, I've got to protect my license so that, if you do bad work, I may lose my license. So I think that you have to instill in the students that kind of a responsibility. And I still tell the students even today, And I think that the students at those times, all right, come into dentistry with a different kind of environment, because environment that the training they undergo is for very basic dentistry, because the basic needs of the people at that time was basic dentistry. But today, you find that if you train the students in the same way, you will not meet the present requirements or expectations of the modern patients. Because the new patients today are very dentistry savvy. Because there's a lot of information in the social media. And if you look at it, if the students don't know exactly what's going on, the patients will know that you're not taught to the level of dentistry of today. And therefore, you find that you lose patients. And we are very dependent on patients trusting the students to do it well. Still happy that there are still patients who will come and see students. And therefore, our responsibility must continue to put the patients first in our training. And for the students and the supervisor, we must come second. And I think that when you actually begin to understand that it's important to put the patient first, then it makes you, when you go into practice, actually you're better prepared for patient care. The other things that have changed, obviously, is now you have more evidence as far as the relationship of the oral health to general health. And it was a difficult time when we wanted to convince the ministry that, that is important. But at that time, there was not enough evidence. But today, ministry is supporting it because they know that all these are evidence-based information. And therefore, contribution to full health of the patient becomes more relevant. So again, here you see that our responsibility becomes different. And therefore, our training must be in conjunction with this kind of changes in the expectation and needs for the patient. Yeah.
No, you are actually advising many people at this moment of time on what you said, because you lead in what's to come. I mean, even at this age, you still go out and find out what's the new stuff. how do we educate students better? Like last night, you were telling me that you've just seen one of the best training AI equipment that is available now. And that's where we're going with technology. I don't think we can, stay back and practice the way we used to practice. And that's the problem, which a lot of dentists now, after they graduate, our lifespan of career is at least 30, 40, 50 years, like yours. How do you upkeep and make sure that everyone stays in time, in what they're doing? Because we still have people that think continuing education may not be absolutely necessary, that we know everything for now. Yeah.
Well, I think that, when you look at development of every dentist, I think that we would have fallen short of our responsibility if we do not know what's going on in dentistry and what are the improvements made. Interestingly, on this issue, I was responsible for introducing compulsory dental education in Singapore. Of course, there was
you
a bit
were a
of
legend.
concern about this, but after a while talking to the profession, I think they began to accept it, and now it's a part of life of everybody.
Yes.
But I think that every dentist who wants to practice must keep up to date what's happening, because otherwise you are not being able to give your best to the patient. I'm not saying that the old ways of working has changed and is no more relevant. I think that we got to keep up and say, okay, this is available. That even for me, all right, there are certain procedures I don't carry out, but this is all new technology. But at least you can tell the patient that I can't do this, but I will refer you to people who can do it. But this technology is available to your advantage, and therefore you don't, fall short of your responsibility to the patients. But if the patients say, all right, I will continue with you even though you don't use this technology, then all is well and fine, you see. But whatever we are doing, we must maintain the quality that's expected of every dentist to provide a patient, because patients do not understand that part of quality until the time comes when there are complications.
Yes.
Right. But I think that, of course, there's always a challenge. Who is the one responsible for that complication that arises later? So that's the reason why I, at this time, still want to go attend conferences and keep up us going. And it's also for me to be interested in development. And that keeps the person going. And I'm amazed at the new things that have been developed. And I wouldn't have known them if I have not traveled and listened to conferences or attended trade shows.
Yes.
Yeah.
Yes. No, but that's admirable, because we all think that what we do is already the best, or how we're trained, it's already the best. And when we come out, we practice and we get good results, then we get comfortable. And that's the problem, where we get comfortable, but we don't realize technology is moving far ahead. New things are coming out. And that's why sometimes when we develop continuing education, when we put in new things, people are like, no, this is not relevant to me. This is not relevant to me. I don't think we live in this world now where our specialties can stay very silo and individualized. And that's I'm so glad you mentioned we actually need to keep up most of the time, because despite the fact that we might be doing well with what we're doing, but it may not be the best option for the patient. It may have been best option for the patient 10 years ago. Yeah. I think that's the message that we need to bring across. You witness the birth of modern bonding and the shift to ceramics. I think in those days, you probably didn't have composite bonding and stuff like that when you first started. So today we are gluing pieces of glass and zirconium, everything in people's mouth and expecting them to last decades. So do you think that these are better compared to what we had before? Yeah.
I think that the bonding is one of the biggest development in dentistry that has contributed to new ways of treating patients.
Yes.
When I was a student, the main crowns that we were doing were mainly gold crowns. But at that time, of course, fine, gold was not as expensive as today. But when you look at the metal ceramics crowns that came on, all right, there's always that you need to cut more teeth away because you need the space needed for metal ceramic crowns. And of course, for the anterior region, metal ceramic crowns have its limitations as far as aesthetics is concerned. now aesthetics is now a very sought after kind of a thing for every person, whether it's facial aesthetics, whether people go for surgery to improve their appearance. But you can see that there's a big change in what the people want, especially the younger generation. And therefore, because of the bonding, now we can actually make use of newer materials like the disilicates that are actually very much better in quality of providing aesthetic restorations. Yes, long ago, we used to have glass ceramics, but it was very difficult to make them very thin, and they have a limited strength. Although the bonding helps to strengthen the ceramics. Even today, they still have this bond to strengthen the ceramics. But the bonding itself is not the end game, in the sense that, oh, now I can do whatever I want. For example, you can do conical preparations and depend on bonding to hold it up to there. I think that then that is actually a fallacy, and we are not doing justice to dentistry. I think that's the basic principles of crown preparation will still hold. It's only the amount of tooth reduction changes. And bonding has a certain advantage, all right, in that it prevents or reduces the chances of fracture and so on, and improve aesthetics. But a lot of the success of any restoration you place in the mouth is very dependent on occlusion. You may have a lot of bonding, but if your occlusion is going to be not assessed, it's going to be traumatic, and therefore it will cause the restoration to crack or fail. But then first thing, of course, is we blame the material. But actually, the cause is not the material. The cause is actually our not being able to assess that we have not really dealt with occlusion in a proper way. So I think that if you put the two together, I think that the bonding will actually carry out, help the patient to keep the restoration intact for many years to come. So I think we can't just depending on bonding and give away all the other important points that we've got to consider as a dentist.
Prof Chew, thank you. That's I think you hit the nail where it comes to occlusion and what we need to do other than, well, with so many young ones nowadays, when we look at them and I get them to do a crown prep, and although I'm a periodontist and I look at the prep, I don't think I was trained that way. I'm looking at that prep. What's have I missed out something? How of course the reason is because bonding can do everything, but bonding can't do everything. That's what you said. So there comes the fact of aesthetics and the young ones. We live in an era where in those days you will spend time. Everything takes longer. The lab needs time and to do a perfect job, to do a good job. Nowadays, everything is 3D printed, in-house, same day, as quick as possible. Patients also expect that because we live in a world of speed. So what do you think about all these short courses that out of a sudden the young professionals think that they attend something for 3 or 4 days, they become experts and they start delivering master stuff, right? Is there a depth of mastery now? Do we not need to spend time? Do you think dentistry with the AI and technology can help us deliver the same level as what people do usually?
I think that the development of digital dentistry and AI has contributed to the improvement of dental practice, and it also benefit the patients as well. Your question on whether these short courses are good or actually they have their limitations, depending on the course that you conduct. Short courses on implants is a bit of a concern, mainly because if the short courses are just teaching how to put in implants and how to restore, then I think it's worrying. If the short courses are attended by people who are experienced, is quite different. I attended 2 days course on implants, but the situation at that time was different because only prosthodontists and oral surgeons can do implants, and the prosthodontist cannot do the surgery, neither can the surgeon do the restorative. So But because we were already trained prosthodontists, our learning curve becomes shorter. But today, I think that, they open up to general practice and all that. It's not wrong, but I think that it'll be better if actually these general dentists actually goes for a longer period of training so that they can actually be better trained rather than actually just learning to know the how. I think the success of all dental treatment is very dependent on the dentist making the proper diagnosis and treatment plan. Each design for that particular patient is no one treatment plan for every kind.
Yep.
You may lose a tooth, but the treatment plan for that particular missing tooth is different from one patient to another. For example, there may be some situations where you can actually do your immediate placement, immediate loading, and immediate provisionals, but not every patient can do that. And if you pick the wrong patients, then the whole system will fail. Then again, as I said, you will blame the system that the people have taught you wrongly. No, but it's not because your selection patient is wrong. Now, coming to technology, all right, I think that I have the benefit of working at an era where there's no such technology. And now I'm exposed to new technology. And based on the education I have by people who actually are very good in AI and digital technology, I came to this conclusion that it's the user that is important. It's not the technology. The technology is an adjunct for us to make our work more efficient. So when I was younger, to do aesthetic dentistry, all right, then you have to do either direct bonding and build it up in the mouth, or you go and get diagnostic wax up and make the provisionals and so on. And that is actually a very exciting way of doing it, but it's very tedious and time consuming. But today, with the computerization and AI combined with it, now you can actually do your smile design and plan everything. And there's another greater advantage which we never had. All right. Unless you do all these things in the mouth yourself.
Yes.
All right. Whatever explanation you give to the patient,
you can see.
The patient cannot visualize what actually the patient is having. So there is a limitation to that kind of a thinking or that kind of system. But today, when you can actually collect all the information you need from scanning, from CBCTs and so on, and combining them together to help the AI, actually you can build a profile for the patient to see, okay, this is what I need to do for you. This is what the outcome is going to be like. And the patient now can see, oh, this is how I'm going to see, how I'm going to look at it. And I think I'm happy with this, all right? Because now the patient knows exactly what he's going to get. Because otherwise, just by visualization or by you, no matter how you explain,
they can't see.
You still can't have the real thing in front of you.
Yes.
So I think that digital dentistry and AI has contributed a lot to the education of the patient. So now, as a patient, I know, okay, these are the possibilities. Previously, I only know that these are
what the
what I call
dentist say.
theoretical possibilities. I don't know whether it's going to happen the way. So I think that this AI and digital dentistry has actually gone that far to help us become better dentists, all right, provide better quality care, but we must use it rightly. At the end of it, the digital dentistry and AI is not going to do your preparations,
yes,
for example, or placement of implants. You have to do it. And therefore, you find that as long as you understand their limitations, as long as I understand your responsibility, then I think overall, both the dentist and the patient will benefit from this development of new technology. Of course, we don't know what's going to come in the future, but I think that I'm hoping to see more exciting things in the future.
Yeah, that's true. That's true. Well, with what you're saying, do you think the doctors, I know that you say user is more important. Do you think doctors will be replaced given the technology?
No, I had to ask that same question myself, and obviously based on my not being very IT savvy, I would say probably no. But when I attended all the lectures given by people who are familiar with AI and digital technology, the only thing that they always place at the end of the thing is that dentists will not be replaced by technology at this point of time. I don't know, 5 years' time, 10 years' time, we don't know what's coming up. But unlikely so, because I think that these technologies have not reached the level of being able to provide the care for the dentist. Can you imagine, I as a patient go into a room, there's no dentist, it's all robots talking to you. I think that the personal touch is not there. I think the personal touch of a patient talking to a human, all right, is quite different from a patient talking to a robot. And although you may get the same replies, but I think that the care part is not there.
Yeah, that's
all
true.
Right? The emotional part is not there. And therefore, most of the speakers will say AI will not replace the dentist. But another statement they make, which actually I believe in, is that AI will replace the dentists who do not do AI. And the people who will survive in dentistry over the years will be people who use
AI,
digital technology and AI for the management of patients. So that probably is more true than a statement that AI will replace dentists, even though there are now robots being used for doing preparations and doing implants and so on. Yeah.
No, that's a very measured and a very good way of putting it, because we are all confused, right, with all the technology and everything that's coming up. And sometimes patients asking for things that it's not even available because they feel as if technology is there due to the social media or everybody talking about it. But you're right. And very often, a lot of dentists are still not understanding what technology is out there and why we need to understand technology, how to use it. Like you say, the user is so important.
Mm-hmm.
Yeah. So that's where I come back to this point of educating the young ones and us coming out as dentists needing to keep up with what's going on. How do we, I mean, you spend a lifetime gatekeeping, for the standards of dentistry to be practiced safely. How do you think moving forwards now, where technology is sometimes, there's no gatekeeping in technology at this moment of time too. And I think we'll go through quite a messy phase at the beginning. How do we ensure? It's like in those days, I always hear my prof say, if the material is new, it's not been tested, we wait. Don't use it first, right? Do you think we have that time to wait now? Because in those days, you wait for 5-10 years for studies to come out. Now with technology moving at that lightning speed, we don't have time to wait. We literally need to go in and understand and do it and test it. How do education keep up? Yeah.
Right in what you just said. And I think that it's a situation where, because of the development, not in dentistry, but overall in industry, all right, I think the waiting game has to come to an end. I think we must take advantage of what is available to us.
But
for example,
that would destroy science. I have to interrupt. Would it destroy science? Because science takes time to publish articles and test products and studies.
True. Yeah, I think that you need scientific evidence in things that you do. But the scientific evidence actually now come out faster than before. All right, because there are more people doing research. And sometimes in the better companies, all right, they actually do not launch their products until they have done some research. All right. Of course, the research may not have long-term results, but at least you know that short-term results, what they are like. At one time, all right, it's not because we don't want to introduce new materials fast enough. It's because the materials come to us 3 months after people have used it in the other countries, because of the ability to transport things fast enough. But today, with all these high speed, what I call deliveries, I think that we are getting our materials fast enough. And the distributors of those materials are now very willing to showcase their new products with the evidence they have. And they are willing to invite people who have used these materials to talk about them. So when it comes to the dentists, all right, these materials. If you believe that they are promising and they're going to help you develop better quality care for the patients, then you go and try it. And the best thing about it is, now you collect your own evidence. It's a new material that's out, you try it. and because we do reviews regularly, you can always say after 1 year, hey, actually it's working well. And you continue to do it. And finally, you can say, okay, this material, for my own experience, I have actually found it to be successful in its usage. I will now want to go and talk about it. And therefore, you go on a platform and lecture, whether you don't have to go to international stage to lecture, but among your group of people, the local organizations, you say, okay, I got this material, I've used it. I want to share it with my fellow colleagues. I think that is the way to go. And I think that will help people to be more daring to now try new materials that have been tested, all right, and get their own results on their own and learn from it. I think that's one way of learning, which is actually very useful rather than just attending lectures, all right? So that's what I do myself. When I have a new material, even though the institution may not have it, I think that I'm willing to go and buy them and try it on my patient, as long as they were approved by the authorities to be able to be used in Singapore. Yeah. So I think it's a very interesting time now, because some of the things you don't even believe can even be developed.
Yes.
All right.
Yes.
But we are clinicians, we are not scientists, and therefore, if they develop something, then I think we should take advantage and say, hey, somebody has done it for us.
Yep.
We should actually use it and find out for it. Yeah.
Yes. Yeah. I think that's inspiring, because we have two extreme. I see two extreme now in the market sometimes when I talk to dentists. Is the older generation that is resistant to change, then the young ones that are jumping in and falling and trying everything, and sometimes not putting the patient first because they're trying new things. And I think that's the part where I find it so difficult to balance, because in education, even when you teach, you've got to decide, do you want to teach this or do you not teach this, or what you need to do. Yeah. But in the very end, as you say, it's the user.
Yeah.
Yeah.
Yeah, it's true. It's true. And it's an experience actually I see that in a while, all right, you'll find that the patients will only go to people who are providing the care they expected. Because in the earlier years of dentist practice in Singapore, the patients know very little about dentistry. They are basically in everywhere. I work in a government service, I work in Malaysia, in Singapore, you find that the patient's understanding that I have a problem tooth extracted. Then I put a denture in. But that was the culture and knowledge at the time, and you don't blame anybody about it. But today, patients sometimes know more than a dentist, because of social media. I got a very interesting experience to share with you, where one patient came to me and said that, I would like to have implants done. Can you tell me something about it? So I explained to the patient the whole procedure and the outcome of surgery and outcome of the restorative part, and the cost of it and so on, and then the complications that may arise. She made a very interesting statement to me after that. She said, okay, I think I can trust you to do the implants for me. I said, why do you say that? Because I've read it in the social media first. At least you can tell me that what is actually in the social media is what you also said. All right. And therefore, I think that you know what you're doing. So if today you come and tell the patient something that you know nothing about, then come tell you, actually, you know nothing about what you're supposed to do. I don't think I want to see you. And I think that this will actually be the pushing factor for dentists to develop.
Yes.
All right. That's why you find that more and more people are wanting to go and do continuing education than before. When I was a young dentist, the number of people you see in attending continuing education is unbelievably small. And most on the top of it is, it was actually free.
Yeah.
Now, you find that people that attend congregation more in numbers, and you're willing to pay for training. So I think that is very encouraging kind of event that we are seeing. And I think that, I encourage dentists to continue to learn new things, all right, to help them to do better, because it not only just improve the work you do for the patient, it also improve your lifestyle as a dentist. You don't have to struggle so much.
Yeah.
Okay, you complete your work faster and easier, and therefore you have more time to spend on yourself. Yeah.
Yeah, that's true. That's true. I think that's one of the messages that we also, because sometimes public or patients expect that you are a dentist, you are fully qualified, you've got a degree or you've got a master's or, you're a specialist, you're supposed to know everything. But the fact is that, there's a difference between whether you keep up with time and you don't keep up with time and what you do. And also now we live in an era with social media. So even if you are just a periodontist, you need to understand occlusion, you need to understand pros, you need to understand about sleep apnea, you need to understand about every other thing, because I don't think we live in this era that, okay, sorry, this is my job, that one, I don't know what's going on, please go and consult somebody else. Yeah. And I think that cannot, patients don't really accept that very much now. Yeah. They even in medical, I'm quite sure in medical is, if you don't know, how do you know who to refer to?
Yes, that's right.
To that extent. I think that's so great that you talk about this, because the public is the one that actually needs to hear this. And you don't expect everyone to be the same.
But only the other thing is not just that. I think that if you know your work and if the patient comes and quotes something from the social media, you can correct them and say that, this is actually not true.
All right. Yeah.
And so that they will not go around thinking that that's the way to do it. Especially nowadays, especially the over-the-counter products. They do think that everything is so easy to use, and say that you can advise them so that they don't get trapped into whatever has been as a sales gimmick for the public. Yeah.
Can the counsellor do anything about those things? There's so much going on.
No, I think that there's certain responsibilities of the counsel. The counsellor is responsible to make sure that patients are properly treated. But I think this is where the role of the dental associations that come in, where they can educate the public through their comment on certain things that they feel that's actually not totally correct. All right, but they always, of course, the associations have to be very careful about condemning them without any evidence, because it's very dangerous.
Yes, it's very dangerous.
So I think that there's a balance that, education must be done in a professional and ethical way. Yeah.
I think that's the hardest balance in medical as well as in dentistry, because certain things that we say can be taken out of context as well. Yeah. So before we go into public advocacy, I wanted to talk about the young ones and inspiring the younger ones. Any advice that you would give to the younger ones when they feel that the life is hard? Because, we have people burning out at 40 years old, and while you are reaching your peak and still peaking at 80 and still going on, hopefully for the next 10, 20 years, what would you tell the young ones? Yeah.
No, there are a number of reasons I have gathered from young people who have gone out and retire early, 40 years old, 50 years old. And that is because they find a different interest. And there are times when, even though you interview students to come into dentistry, and they say, I really want to do dentistry because it's a very noble profession. I want to help people, and so on. But when you finally graduate, they find that actually that's not what they really want, and they find that it's a very stressful life. Patients are more demanding now than before. And therefore, they find that they want to move into another industry. I got one dental colleague who gave up dentistry to start a fishing industry, selling ornamental fishes. But they are quite happy with it. So you find that each of us are different in our expectations when they're young. Some people will leave partly because of their health problems. But I think that for those people who leave because they feel they are burnout and so on, I think that probably they may have not been practicing in the right way. They don't get a satisfaction of being a dental professional. But I think that if you find that managing patients and helping them achieve their goals over oral health and general health, other than just treating the tooth, then you find that actually it becomes more rewarding. You stay on. See, but let's say if I come a patient, I look at it and you got this thing to do. I just do the filling and do that, and then extraction and do extraction, or whatever I do. I just do it for you. Then I think that you find it very boring. But I was telling a friend yesterday that today the dentist must look upon the patient as a different concept. It is not enough now for us to treat the tooth without treating the patient. And I think that if you treat the patient rather than just the tooth, then I think that you probably stay on working.
Because it's so interesting.
Because I think the patients will be appreciative of what you're doing. And based on my own experience, I'm not too sure about yours, that most of the time, patients are referred to us by patients. The majority of them are patients. The the minority is actually from a dentist. And because, there are so many people in the same specialties, so because so many people go. But the ones that come to you are really ones that are referred by the patients. And that is not because now you're happy, I got now more patients to treat. No, I look upon it that what I've done for the patient of mine has been found to be satisfactory to the patient, is happy what I'm doing, and therefore he has confidence of referring new patients to me, whether it's their family or friends. So with that kind of a environment, I think that it will be quite difficult for the person to say, I'm in burnout. No, I don't want to practice dentistry, because I think that finally is a personal satisfaction. Yes, part of it is a passion, but a passion has its limits. If you find that you don't have any satisfaction from the passion, you finally will dwindle. See? So I think that's how I see why some of the people actually leave early. Yeah.
No, but it's amazing that you're giving us a different view of what you think when they burn out, because very often when people say they burn out, they blame it on dentistry. In actual fact, like you say, they probably have another interest or didn't see the light of what's going on. We go through a lot of failures, and sometimes with the younger ones, we all make mistakes through our lives, and you have probably failed some students as well. What do you think is critical that allow these people? Do you pass them again, or what really define they are not safe to go out? And even if they go out, they fail and make mistakes again. What I wanted to say is to these young ones, how do you encourage them to continue, lift up and go on? Because I've seen many who failed, and in early stages of their career, they feel as if it's not worth it and they want to go off. And I always say, you've not given it enough time, not knowing what to do. And being young, you're unable to treat the patient as a whole because you don't have the experience, nor the knowledge, nor the training to be able to do that. So what would you encourage the young ones when they feel like they have failed? Yeah.
I think the situation is a concern to all of us. Mm-hmm. And to be fair to any teaching faculty, including the Faculty of Dentistry in Singapore, we will not be able to train the student to be competent in everything.
Yes.
All right. Because I think that the patients that come to the school for treatment is a different profile from the patient that go to private practices. And because the patient knows that they are being treated by students, the expectations are slightly different. And therefore, it must not be a belief of the young students to say that when I graduate from dental school, I know everything. I mean, even when I graduate from the specialty training, I still think that I do not know everything. And therefore, a lot of it has to be built up through your own experience and through education. And we are fortunate now that there are courses being conducted to help us improve.
Yes.
Can you imagine that there are no courses?
Yes.
You actually now struggle on your own and make your own mistakes. And sometimes the mistakes you make may be so drastic that the patient will sue you for whatever you do. But I think if there are continuing education courses, we must take advantage of that availability. And I think that, but of course, the courses that are conducted must be relevant to the improvement. So I think that with whatever is available for them, and I think that when we inform the students and train them, that they know that actually whatever training we have has its limits. Because if you really want to train them in everything, you can increase the number of years. By the time you increase the number of years to graduate in 6 years, for example, by the time you go out, still you will not know everything. So I think that, that is what I feel that is important, that we calculate into the students the need for continuing education after they graduate. All right. So because nowadays in dentistry, you don't have housemanship.
Yeah.
But in Singapore, we are a bit fortunate that we bond our graduates for 4 years to be in the public service, and during that 4 years they have exposure to many things with the guidance of the senior people there. So but of course There are some who straight want to go into private practice and because the companies buy them out or whatever it is. But those are few and far between. So I think that with that 4 years of training, they will actually benefit from that exposure. And at the same time, during the 4 years of training, they can attend courses, and institutions actually provide them with a certain amount of funds to attend courses.
That's amazing.
So everything is there for them. Is there for them to take advantage of it. Yeah.
Yeah, I think it's a person as well, the student themselves, whether they want to continue their path of learning. Yeah, and it's hard. It's hard. I always admire academics like you and the dental schools personnel, because it's so hard to do education now, and quality education is, you might have lots of continuing education out there.
Yeah.
How do you discern which one is quality and which one is suitable for you and which one is the one that you should be attending? Because we have seen some continuing education that does more harm than good. How do you regulate then? And the young ones cannot discern between what is quality and what's not quality continuing education as well. Yeah.
I think that the regulation is not something the responsibility of organizations. The regulation actually is to be done by the dentists that attend the education programs, because they know whether it helps them or not help them. And I think that if I, for example, attend a course that is not going to do anything good for anybody, I'll inform my colleagues this particular course is not worth attending. So it's kind of a self-regulating thing rather than actually has to be regulated. How are you going to say, okay, if you want to conduct continuing education, the only way I can assess whether you are doing it right is you got to give me the lecture first. Like, give me the full lecture program, not just send me the synopsis, but I got to listen to you fully. Then I say, okay, we certify this one to be what I call valid for certification. So I think that's not possible. But I think that the self-regulation, I think, is a better way to do it, because it doesn't across the professional ethical code of the organization as well. Yeah.
No, that's interesting to know, because I think I was asking you a very tough question. Is there going to be regulation coming out for continuing education? Because we see so much of what's going on. All right. If you could leave one message to a billboard for every patient and professional to see, what would it be?
I think that, you really have to be responsible and put your patients first. And the only way you can put your patients first is by developing yourself to provide the services that are going to meet the expectations of your dentist, of your patients. Not only that, but also to gain the respect of your peers that you are contributing to good dentistry in your own country.
Yeah, that's true. I think to put the patient first is very often said, but a lot of people don't understand how deep that meaning is for that sentence. But you have put the patient first and the students first for your entire life. I think you've contributed so much to dentistry. We can never thank you enough, and truly an honor. And I mean, you bring tears to us and many of us that have been trained and look up to you. We really, really cannot thank you for guiding us and making us do what we do today. Yeah. Thank you.
I would have to say that it's not just me, but I think it's the opportunities given to me. All right. And I think that if
You're too humble.
take advantage of opportunities, we benefit from it. But if we miss the opportunities, then we will not really get it back again. Yeah. And so I must thank the people who give me the opportunities to do the things I do.
A lot of people are given opportunities, but not necessarily take it. That's the only difference. But you decided to work hard and did so much for us.
Thank you very much.
Thank you. We started this dental podcast because we wanted to make every day a little bit more joyful, and that's why it's called Dental Optimist. Because Optimist was developed in the 60s, and I think that was during a time where joy was probably not as much as what it is today. And this is not a toy, so I hope this is something small from us, which is very hard to remove. I think I got it. All right, before I destroyed it. And basically, we wanted to make sure that, if you can put it in your office.
Oh, it's caught there.
Yeah, I think it's caught there. But
very cute.
Yes.
Yeah, thank you very much.
No, you're welcome. Every day. And you've made so many patients' life more joyful. Thank you once
And
again.
thanks for the opportunity to do this podcast with you.
No,
Thank
thank you for inspiring all of us, and I'm quite sure I can't wait for another good 10 years of you inspiring and doing greater things for Singapore.
I look forward to it too myself.
To all of us. Thank you.
Okay, thank you very much.
No, you're welcome. Thank
Thank
you.